All right. Good morning, good afternoon, everyone. We are so excited to have all of you here today. Welcome back to another County Santa Clara Lab Speaker Series, where today we will be learning about Public Health Department, what they do and career opportunities. My name is Ray Ha, and I am the host for today's section. I work as a recruiter at the Employee Services Agency Human Resources Department at the County of Santa Clara. This live event will be also recorded on multiple platforms such as LinkedIn, Facebook, and YouTube. So folks who are unable to attend at this time can watch it at a later time. As we introduce our department, please feel free to drop any questions you might have in the Q&A section, as we welcome open questions. Before we begin, we just want to say thank you so much for taking the time to join us today and sending your questions prior to the event. We received a lot of great questions, and we would love to address some of yours live today. All right, I hope you are all having a wonderful day so far. After today's event, I'm looking forward to connecting with each of you and having some engaging conversations. We have created a QR code and a shortened link, as you can see on my screen. The bit.ly/PhD quick page, which will take you directly to the public health quick career page with different resources. Once you're on the page, you will find all current public health job openings, and we have so many job openings today. If you don't see what you're looking for, no worries, because you can always click on job alerts and subscribe, receive email notification for specific positions. Additionally, you can learn about public health main page by visiting the website. Lastly, we encourage you to review the outstanding county employee benefits that are available. All right, thank you all for being here today. And we hope you find this information useful. You will also see the QR code on our backgrounds throughout the event. For those who just joined us, welcome. Without further ado, let's get this event started. We are very honored to have with us today Dr. Sarah Rudman, the Deputy Public Health Officer, Charisse Feldman, the Public Health Nurse Manager, and Wayne Enanoria, the Chief Science Officer. They will be sharing their valuable insights with you all. Thank you for taking the time to join us today. So Dr. Sarah Rudman, could you please introduce yourself and the team?
Sure, thank you. Very excited to be here today. I'm Sarah Rudman. My background originally is as an infectious disease doctor, and I'm one of a handful of doctors that work throughout the public health department. My role as Deputy Public Health Officer means that in addition to supporting our work all over the county in enhancing health for the community residents, I lead our infectious disease and response branch. And I came into this role just a year ago after 6 years with the county as our HIV and sexually transmitted infections controller, which meant I led our sexual health and harm reduction work. And I have seen the department grow and evolve even prior to the pandemic, and then the explosive evolution of the department over the last 3 years has been especially exciting. So I'm pleased to join you all today.
Charisse?
Hi, everyone. My name is Charisse. I've been working with the county for almost 22 years. I started my nursing career in acute care at a local hospital, but found a deep connection with public health after my service in the Peace Corps. And although I have worked in a variety of nursing positions in public health, I'm super thrilled about my current role, working in maternal child health as one of the nurse managers here. I'm excited to talk to you about the job opportunities and provide you with information about our nursing teams. Thank you so much.
Wayne?
Hello, my name is Wayne Enanoria. I'm the Chief Science Officer, as mentioned. I'm trained officially as an infectious disease epidemiologist. I've been in public health for over 20 years, but in this role in less than a year. And I'm really excited to be with all of you today to talk about all of the great data science work that we are doing currently here at the health department.
Thank you for your introduction, everybody. We are so proud and excited to have all of you here with us. Please drop your questions on the Q&A section. so that our staff can help answering some of your questions. Dr. Rudman, I know for sure a lot of folks here are so eager to learn more about what we do. Could you tell us a little bit more about Public Health Department? What roles does the Public Health Department play in the County Santa Clara? And how does it impact each individual and our communities?
Right. Well, I think after the last several years of responding to the COVID-19 pandemic, what a public health department does, especially on a local level, is sort of more visible than it ever used to be. But I think it makes it a particularly exciting time if you've worked in other areas of healthcare, science, community support, and enhancement, to think about joining governmental public health. And I'll tell you a few reasons why I think if you've worked in public health elsewhere, considering working in the County of Santa Clara is particularly exciting. Now, the way we're structured here in Santa Clara County, again, at the local level, where we really get to work as close as possible to the communities we hope to impact and help thrive, we are structured with 5 key branches in our department that really cover the entire spectrum of what healthcare looks like and public health can look like. And by that, I mean, we don't just deliver services, as you asked. Some of what we do is think about who our most vulnerable residents are and what service gaps they have and fill those gaps. But we also work at the complete other end of the health spectrum to say, how do we prevent people from needing healthcare services at all by creating healthy environments, healthy policies, or new knowledge that helps us understand how to help people stay healthy? So those 5 branches, the way we're divided up, include a healthy communities branch that works primarily at that policy level, thinking about things like, do people have a safe place to exercise and access to healthy foods and the education and policies they need to reduce tobacco use or other substance use? We have a maternal child family health branch, which you'll hear quite a bit about from Charisse in a bit. We have the infectious disease and response branch, which I lead and you've been hearing quite a lot about for the last several years. It's the group that does things like monitor infectious disease threats like COVID and help us be prepared to respond to them and understand how they're impacting us. We also joined just over a year ago with our Department of Environmental Health, which means we have a much more integrated capacity to think about things like climate change, community environmental impact, consumer protection, food safety, and do that in an integrated way with our other work. And then finally, you'll hear a great deal today from Wayne about our brand new science branch. And this is something that I think Santa Clara County is the only local public health department in the state, maybe in the country, to have. It is a place where we have consolidated some of the most important experts in understanding health science, whether that be traditional epidemiology, but with advanced methods, informatics, which is how we get access to the data and the science we need in an automated, modern way, and even advanced scientific capacities like health economics, demography, and statistics. And you'll hear much more about that from Wayne. But all of that bundles up to create a department where I think we're able to do something with a greater level of impact than other parts of healthcare, other parts of governmental service where I've worked, because we think across the entire spectrum. And we have 3 core principles that guide how we do that. The first and most important is equity. We are constantly asking ourselves, who are the most important populations by any given health threat who are being impacted disproportionately? And what do those communities tell us they need? Secondly, we are grounded in science and evidence and data. And we're living that grounding by creating this science branch that helps to keep us able to be informed in the most modern and best information we have to make tough public health decisions and utilize our resources. And then finally, we value our workforce. And I think there may be a lot of ways that come out today, and I'd be happy to answer more questions about what that means, what that feels like to work in a place that truly appreciates that we cannot do what we do without caring deeply about the people who do it. So I feel very fortunate to work here and happy to take more questions later about what roles we have available in each of those areas. I'll leave you with an image, which I'll ask my colleague to post, that just shows some of the ways that we engage with community members as we do this work. So as I said, some of this happens in the background, in front of a computer or in a legislative work group or in a think tank-like environment. But a lot of what we do is out in the world, engaging with the communities we're trying to serve. We offer harm reduction services, health education, health fairs, and again, nursing services that go into people's homes and make a difference where they are living and to help make sure they're thriving. So just to give you a glimpse into what our world looks like, and then I'd love to hand it back to you, Ray. Thank you.
Thank you, Dr. Rudman, for providing a quick summary of the County Public Health Department. It is a great privilege to be part of the County Santa Clara workforce, and in particular, the Public Health Department. And our ultimate goal is to create a strong, healthy, and resilient community. And serving nearly 1.9 million residents is not an easy task. And I'm so impressed by the dedication and work of everyone in the department. So moving along, I know many of you here are so excited to learn more about nursing programs. So let's turn our attention to our Charisse. Could you tell us a little bit more about your nursing team and share why you enjoy working here?
Oh, absolutely, Ray. Thank you so much. And thank you, Dr. Rudman, for just painting a wonderful picture of our department. So back to our nursing teams. We have multiple nursing teams across the department. For example, in our infectious disease and response branch, we have public health nurses that provide case management and home visiting services. They also offer disease investigations and infection prevention services. Like, for example, we have nurses that follow up with patients who have active tuberculosis or individuals who have contracted a communicable illness. We have nurses that work with healthcare providers and healthcare facilities to help mitigate the spread of disease in their facility. In our maternal, child, and family health branch, we have several nursing home visiting teams that see clients of all ages across the lifespan. We have clients who are pregnant. We have infants, we see children and youth, as well as adults with complex medical issues. Our nursing teams provide comprehensive case management, education, linkages to resources in the community, and really help uplift and empower those that we serve. We do also have a couple of nursing teams that work really closely with social services and the Department of Family and Children Services that provide case management and care coordination to foster children and youth. Within the nursing department, we do have teams that provide evidence-based programs, such as Nurse Family Partnership and Strong Moms and Strong Babies. And so that, when thinking about the almost 22 years that I've worked here and why I enjoy working for the county and the public health department, I think about two things. I think about the people that I work with and that I work for, and then I think about the opportunities. And I think, just thinking about my work as a public health nurse too, so in thinking about the positions, we have public health nurse 1s, 2s, 3s, and we have public health nurse specialists that are all non-managerial type positions. I've been able to work as a PHN 1, 2, and 3, and the opportunities for me as a public health nurse too, I had the opportunity to work in 4 different programs, everything from addressing childhood-led poisoning prevention and doing home visits, to working with the emergency preparedness team and being part of a training that had a live mock active shooter training over at the DePaul Hospital in San Martin or Morgan Hill Gilroy area. So just a lot of variety, and the opportunity for a public health nurse to go through the career ladder. Now that we've kind of expanded and grown as a department, there are a lot more opportunities than there were in the past. So I think that's one of the 2 things that I love working here the most, and I stick around for as long as I have. Thank you.
Thank you, Charisse. Really awesome to learn about great things that public health nursing plays in promoting and protecting the health of our residents, especially in the maternal and child health unit. I know we are tasked with protecting the health of mothers, children, and families in our communities, which is a critical responsibility. I believe that by providing high quality healthcare services and resources to these groups, we can make a real difference in promoting healthy development and well-being in our community. So
Absolutely.
folks, please feel free to keep your question coming. We will do our best to address your questions or direct you with the appropriate resources. All right, now let's turn the microphone to Wayne. We are curious to learn about your science team.
Yes.
And the daily activities that your team is supporting different branches. Could you tell us more about your your team and the branches that you're supporting?
Yes, thank you very much. I first want to start by saying it is an incredible honor to be here in Santa Clara County, working as part of the science branch. Again, as Dr. Rudman had stated before, being able to create a science branch with the public health department is truly a unique opportunity. I think, given all the things that we've experienced over the last several years, it is just nice to finally be at this stage. I started public health back in 1994, and I think about all the different, for me, infectious disease events that we've experienced over that time from 1994 till the present. And I can't tell you how exciting it is to have a science branch as part of a local health department that is truly going to focus on the use of science and data to support decision-making and public health actions going forward. It is just a really unique opportunity that I can't even express my sincere gratitude and how honored I am to be in this position as Chief Science Officer and Director of the Science Branch. So as Dr. Rudman said, we are filling in scientific disciplines that traditionally had not been part of a local health department, like health economics and demography, and being able to create key positions that will help us as we think how we are going to continue to improve population health and tackle health inequities within our communities. I do think the science branch is fairly unique in that it does have under its umbrella a very robust public health informatics unit that we will be building. And I'm really pleased to know that we are focusing on the future as far as building a data lake and thinking about future data science analytics and higher level analytics and systems that we will need to be able to do that. So it's kind of putting us into current times as far as the technology and the use of data to support public health actions. I think also what's really exciting is there is a strong research and evaluation arm of the science branch to ensure that whatever work is happening both within the branch as well as across the department, that all of the lessons learned, how can we start to improve what public health actually does in the community in terms of just interventions and programs and thinking about all the services that we provide to our communities. So it is really, truly a powerhouse of just really technically, scientifically driven folks, but applied in a very strategic way to support all of the initiatives that we have. And we have a number of them and tackling high priority areas like violence in our community and climate change and infectious disease, continuing to prepare for whatever may come our way as far as infectious diseases, chronic diseases. So science branch is not only going to have these scientific disciplines, but is also an opportunity to work across the broad spectrum of public health issues at large. And I think Santa Clara County in particular is a leader in many of these areas. So it's a very unique opportunity for somebody who wants to be involved, exposed to many different public health issues that affect our community, to really work in a data science focused way to then work on problem solving and work on how do we improve population health overall. So we do have a strong focus on community health with our health assessments and racial and ethnic specific health assessments, as well as really focusing on health equity and issues of equity.
Thank you, Wayne. It's clear that our science team plays such a vital role in supporting public health by providing strong research, analysis, statistical support across the wide range of programs and branches. In my opinion, your team plays a crucial role in supporting efforts to prevent future outbreaks and promote public health and safety. Thank you for all that you do. I really feel proud to be promoting the team, and today we are looking to attract new talents to join us. So welcome the new attendees who have just joined us today. Please scan the QR code with your phone or visit the bit.ly/PhD quick page to check out openings, as we have a lot of openings today, such as Epidemiologist series, health education specialist, health planning specialist, public health nurse series, and much more. So continue dropping your questions to the Q&A section. All right, I know what you are all waiting for. Let's move on to the Q&A section and address any interesting questions that come up. All right, first off, we had questions about diversity, equity, and inclusion, DEI. I know Dr. Rudman, you talk a little bit about inclusion of our employees. So could you tell us a little bit more about the initiatives and efforts that the department has in place to promote DEI?
Absolutely. So I think one of the most important ways that one of the things we mean when we say that our ultimate goal as a public health department is achieving health equity must include representation within the public health department itself at all levels of activity and all levels of leadership. And so we work explicitly to make sure that the same communities whose health we're helping to lift up and empower to create opportunities to live long and healthy lives are represented within every layer of our public health department. So we not only have diversity, equity, and inclusion policies across the county, but specific activities where we aim to try to go out and meet with the communities, folks who have lived experiences in the areas of health we're trying to make changes in, who have expertise in the local neighborhoods we're trying to work closely in partnership. And I hope that we are doing the work to go beyond simply diversity and equity, but what we think of as belonging, where this is not just a place that welcomes people of all backgrounds and lived experiences, but is owned by them, that is a place where people who represent the community we're trying to serve feel this is their public health department that they help to lead.
Thank you, Dr. Rudman. We talked about it many times in our previous events, but I like to reiterate the message once again. Diversity is something that the county really cares about. Diversity in our workforce is a county's commitment to promote diversity, equity, and inclusion within the organization through services of delivery. And as stated in our policy, the county believes that the various perspectives generated from different backgrounds, abilities, professional experience, life experience are critical to our success. So this is why the county is one of the leading public organizations that highlight the work of diversity, equity, and inclusion. Great question. Next up, we have a question about public health nursing. Could you tell us about career opportunities and the job requirements? Charisse, could you provide some insight into this, please?
Oh, thank you. And I do see a question in the question and answer about public health nursing and the requirements. We are constantly recruiting for public health nursing positions. Right now, we do have, we are actively recruiting for public health nurse 1s, 2s, and 3s. I had previously mentioned. We also have public health nurse specialists that is a non-managing PHN position. Public health nurse 1s are for entry-level public health nurses, such as new graduates or other nurses who yet to have public health experience. I know I saw a question about, I don't have experience. I'm a new graduate with a PhD certificate. So I'd love to maybe love to tease that out a little bit. But basically, we are a county that offers a public health nurse 1 position and really train and support nurses who are new to the field. Public health nurse 2s, which is the majority of our nursing teams, they conduct home visits, they conduct disease investigations and follow-up. These are nurses out in the community providing services to families and individuals that need support and assessment. We have public health nurse 3s that have more of an in-depth knowledge on a particular area of interest. They often are leaders in their field. They often collaborate with partners and communities on a variety of initiatives and topics. And then public health nurse specialists have definitely specialized knowledge, and we have nearly a handful of public health nurse specialists in our infectious disease and response branch. One particularly in the TB program, tuberculosis, and then we have a couple in our communicable disease program. Now, as far as job requirements, if you have previous experience in public health and you're interested in, that all of that experience would come with you with the public health nurse 2 position. But again, I wanted to stress that we have public health nurse 1 positions where we would take, a nurse with the, requirements, which is an RN license from California Board of Registered Nursing, as well as a public health nurse certificate from the California Board of Registered Nursing. So thank you.
Thank you for the question.
Mhm.
Yeah, it's great to hear about public health nursing offers a broad range of opportunities for those interested in pursuing a career in this field. And I'm confident that many people who are listening today will do their due diligence to check out various programs that are available to them and choose the best that aligns with their goals and interests. As the question about qualifications and requirements, let me explain a little bit about HR screening process. So scan this QR code, guys, and explore all of our openings today. So when you're viewing our job postings, you'll notice a section about employment standards, which basically mean minimum qualifications. For example, a position may require a bachelor or a master degrees, as well as several years of working experience. Therefore, when you're filling out the application, it's very crucial to provide comprehensive information on your educational background, job experience in the first to 10 years, or even further, or projects, internship, volunteer experience, because HR will use this information and determine your qualifications. If you have further questions, I would be happy to discuss the HR process towards the end of this section. Let's move on to the next question. For the science team, Wayne, what kinds of new data positions are being created?
Great question. We are actually creating higher level epidemiology positions. So we have an epidemiology manager and an epidemiology supervisor, actually 2 positions that we're hiring. And this is adding to our series, our epidemiology series that we currently have, which is Epidemiology 1, Epidemiology 2, and the senior epidemiologist. So there's now actually 5 levels for one to be in if they want to be an epidemiologist within the county. We're also hiring a demographer, a senior statistician, a senior health economist, a principal public health informaticist. Again, these are all just great additions to the public health department because this allows us to now have expertise that we did not have before and recognized during COVID and through other events that we greatly needed to help us with just understanding our population and characteristics of our population, being able to project, the population in terms of growth, birth, death, processes, etc. We're also hiring a QI manager and a senior health economist. So again, I'm really excited about a health economist because that will allow us to really focus on decision quality, that is really thinking about all the things that lead to a quality decision in terms of any decision that we have to make in public health, weighing out various alternatives with respect to anticipated health outcomes, as well as economic and cost considerations. So there's many reasons why a health economist, I think, is going to enhance the work that we do just to make us sort of better at our decision making and making sure and keeping us accountable for all the different considerations in making our decisions. So it's a unique time, like I mentioned, to be in local public health right now, and it's an exciting time because there is just so many public health issues and so many things that we now have to tackle, given what we had sort of had to deal with during the pandemic. So I think now's a really good time to be thinking about our scientific infrastructure and the science branch in particular, and how do we move into higher level data science and analytics.
Excellent. Thank you, Wayne. Given the pandemic situation that we've been dealing with the past couple of years, I believe that the new data-driven decisions can be instrumental in helping us identify and predict disease outbreak patterns. These positions have the potential to significantly improve our ability to respond to public health challenges. I'm optimistic about the impact they can have on our communities. Thank you to all of our attendees for these excellent questions. We value your participation and engagement in today's section. If we are unable to address your questions live, please rest assured that we have a full team in the background that will support you via chat. Don't hesitate to send your questions our way, and we will get back to you as soon as possible. All right, next question. We have a question about turnover rate. Could you share with us how your employees are enjoying the work and culture at public health? Is there remote flexibility? Dr. Rudman, could you please answer this question?
Sure. So I think I'll start to your first piece about turnover. I think one of the reasons we have so many opportunities available right now, there are two big reasons. One is that we've taken the opportunity of recognition of what the public health department does, how important and crucial it is for public safety and wellness, especially in times of pandemic, but even without. And use those opportunities, funding that's come to create, again, some of these really novel roles and structures sort of out in front of the public health departments like ours around the country. So there are new opportunities that haven't existed before, which really offer people an opportunity to craft what their role can look like and how they can contribute to public health. In addition, I think for many of the listeners, I imagine, whether they were in school for the last 3 years or in another area of healthcare or public health, another governmental position, it has been an incredibly challenging 3 years, but there have been some massive silver linings to it, like better understanding what kind of informatics and science structures we need to be more prepared for today's health threats and whatever's coming next. It's also created huge opportunities for promotion. A lot of people were pushed to learn new things during the last 3 years. And I think one of the things public health department did well is take that opportunity to say, hey, if you learned something new, we want to help you leverage that to do what's next for you. We're constantly trying to use these opportunities that challenge us to help people move forward in their careers, and constantly looking at every position. What does the career ladder look like for that position? How can we get you from where you are now to wherever you want to be? Do we support your education? Do we support your cross-training in another content area? Do we help you work on projects with colleagues in a different area? Or someone in your chat thoughtfully asked, if I don't have management experience, how could I join and gain it? And we're constantly looking for opportunities for people to work out of class where they cover for their managers when they're out, or gain other management skills like assisting in hiring processes. So while we do have quite a number of vacancies between these new positions and situations where people have promoted and created new vacancies, I'm pretty excited to say these are openings for good reasons, and very excited to have some of these new folks join our field, whether you're coming from other parts of healthcare, whether you're new to the field, or whether you're considering a move to Santa Clara County from other public health departments.
Thank you, Dr. Rudman. I would be happy to provide further information about hybrid and telework schedule. So,
and I'm happy to address that. Thank you for reminding me. Mm-hmm. It is something that, so opportunities for telework, for hybrid work, are things that we have sort of pushed to create flexibilities. Again, the pandemic forced us to learn new ways to work very quickly and to recognize which of our services were amenable to virtual work, and where others were not. So clearly we have certain positions that are in the field working closely with clients. And in those cases, virtual work may mean not having to come back to the office in between, going straight from an hour at home out into the field and back. And for others, we are able to integrate some time in office versus some time fully at home or otherwise working virtually. And we found that that's in line with our values of caring deeply about our workforce and trying to make the hard work that you'll do to make your community safer something that works for you and your families and your households, as well as our goals to impact climate change and help people be able to reduce their carbon footprint. So it's something we continue to look at and make sure we're doing it well, using it as a tool to both make your work lives better and make us work better as a department.
Thank you, Dr. Rudman, again. Just a little bit more clarification for all new hires. At the county, we really prioritize the work-life balance and mental health of our employees. However, as most stated in our policy, generally all new hires must complete the first 9-month probationary period on site. After passing the probation, and with the approval of supervisor and the department director, the employees may be granted access to hybrid or telework arrangement based upon the nature of the work assignments. We understand the importance of flexibility in today's work environment. So we would love to provide flexible schedule opportunity to our employees. But at the same time, we want to be transparent with you all. Wayne and Charisse, do you have anything else to add to hybrid schedules?
Yeah, we do have public health nursing teams that have a hybrid schedule. It does, depending on the programmatic needs and the needs of the community and the work that needs to be done. But yeah, stressing the flexibility and understanding the environmental impact it has served a lot of programs really well. Also, some of our nursing teams also have alternate work schedules, such as a 4-10 schedule, which means you work 4 days a week, 10 hours a day. And so that's, negotiated with the union and agreed upon and constantly reassessed. But we also have nursing teams that have nursing individuals that have an alternate work schedule as well.
Yeah, the only thing I'll add is, yes, science branches also has a hybrid work arrangement. A lot of our data work doesn't have to be on site. That is, it doesn't require us to be physically here in the office. But there are times, specifically for meeting with community partners and other programmatic leads, where in office is desired. And I personally value the face-to-face. I think having a hybrid schedule, being able to see people in the office, allows you to work in ways that you just can't do through Teams or Zoom or otherwise. So I do see great utility in having a hybrid works arrangement. And I think we will continue that so long as the policy's in place.
Great, thank you, everyone. That's really great to know about our telework and hybrid policy. We will move on to the next question. It's an important one that I'm sure many of you are very interested in. What does the typical career trajectory of a government epidemiologist look like at the department? How is research experience considered for these positions? Wayne?
Great question. Yeah, no, I think, in terms of a career trajectory, I described, the EPI series, right? We have 5 levels. If you include the chief science officer within that series, because I am indeed an epidemiologist, then that makes 6, right? So I don't know any other local health department that has 6 levels of an epidemiology classification or, for an epidemiologist to be in. So it is a great arrangement, great structure that we have here in the county. I'll say as far as, trajectory, we have many staff that go on to get higher degrees or move into other areas, other scientific disciplines, maybe even go back to academic settings and that sort of thing. So there's no real set path for an epidemiologist that is sort of, comes out or raised in a local health department like Santa Clara County, and then moving on to something else. I would say we are, because of our research partners and our academic partners, we are very tapped into the academic settings because we work very closely with them as a local health department. So it feels, yes, we are in an applied public health setting, but it does have elements of academic rigor and methodology for sure, because we have to bring those that training and those ways of looking at population health and examining population health to the work that we do here in the science branch. So I'm excited. Again, I feel like it's a great place to have not only these scientific disciplines, but I'm hoping, like Dr. Rudman emphasized earlier, that we will be able to hire folks with various lived experiences. Because I think with those various lived experiences, you have a perspective that will shape how you see the world. And that will very much influence the types of questions you ask, the data that you decide to collect and how you analyze that data, how you report it out, and what you do with that information. So having various lived experiences represented in the staff of the science branch is critical for us. And we will continue to be and remain committed to diversifying our lived experiences within the branch because of that. So I see many opportunities for epidemiologists, not only just here, but even if they decide to go on elsewhere, WHO, CDC, other state health departments, other governmental agencies, or other academic settings, or even in the nonprofit world. There are many sectors that actually could utilize epidemiologic training, epidemiologic thinking, system science, and really systematic, deep problem solving. So I feel like the training that you get in epidemiology, the experiences that you get here working in the county, can serve multiple areas, not just higher levels of epidemiology.
Thank you, Wayne, for your specific insight about these science roles. I think it's very helpful that there's a career ladder on these roles, and especially how important conducting research and program evaluation, problem solving skill can be in making significant career advancement on the public health field. Just a little clarification on the chat here for Wayne. Does the science branch in the public health department also collaborate with behavioral health services department?
Great question. Yes, we are definitely communicating with our behavioral health partners and strengthening those collaborations in areas like opioid and overdose prevention work. So more to come on that, but yes, we are not only building partnerships outside of the county, but obviously with other partners of the hospital system, as well as other partners within the county itself. For all the issues that we're dealing with related to population health and public health. So yes, to answer your question, yes, we are strengthening our collaborations with behavioral health and figuring out more efficient ways that we can work together in areas of commonality.
Great, thank you so much, Wayne, for the clarification. So this question for Charisse. Could you share with us the day-to-day of public health nurses? Do we offer orientation and trainings?
Well, thank you for that question. In the beginning, I talked about all the different work that public health nurses do in the department. And, there's a variety of functions. We have home visiting nurses that conduct home visits with families. We have nurses that do site visits with clinics to ensure that they have the right equipment and the right tools to provide services in their clinics that do really, really well. So to kind of explain a day-to-day for one particular nurse, I could probably take, a good 20 minutes to do that. But I think there's, I believe someone maybe Oriana put a link to some of the videos that we have. We were working with our communications team here in the public health department to really, highlight the work that some of our public health nurses do in the community. And it showcases Catherine, one of our nurse family partnership home visiting nurses, and just what it's like to gather, prepare, and what it makes, for her to go out into the community and do a home visit. So please take some time to look at those short videos, and that can give you a little bit of what how our home visiting nurses do. But yes, there's a lot of variety that nurses, the kind of work that we do. I mean, there's a lot of the nurses too work with community partners, and they lead collaborations and initiatives within the county. So to that, there's a lot of variety. And as far as orientation, we do have a Public Health Nurse 3 dedicated to staff development of the nursing teams. When a new nurse is onboarded to the department, there's a general countywide orientation that is done, and ongoing, one-on-one meetings with the manager to ensure that things are okay and that the training is on board. But there's a lot of time spent with our staff developer, really kind of going through what is needed to make sure new public health nurses feel confident and supported and, ready to go into and do a home visit. Usually our nurses are paired up with a team of experienced nurses, if not one, but more than one, to shadow home visits, really sort of understand the culture and, think about safety and the tools that you need to be, to do the work that you need to do. So there is a lot of support and a lot of training that's involved. And depending on the program that that a new nurse is hired in, requires additional training. For example, Strong Moms, Strong Babies, and Nurse Family Partnership, some of our evidence-based models, there's additional training that a nurse will go through to ensure the fidelity of the program. So there's depends on what program you're in, it depicts the sort of the training needs of that program. Thank you.
Thank you, Charisse, and thank you, Oriana, for sharing the links on our chat. So everyone, please feel free to explore those videos and learn about our public health nurses programs. All right. Next and quite interesting question. Are the positions we're hiring for grant-funded temporary positions or county-funded permanent position? I'd like to open this question up to all of our panelists.
Sure, if I can jump in first, I'll share that the Public Health Department has a mixture of grant and what we call County General Fund. So flexible local funding behind what we do. So there are some positions that are specifically grant funded, which does sort of define what that position is going to do in terms of content. But in general, every position posted today is a permanent county position. And this means that that position is backed by not only the union agreed upon contract that defines sort of the protections of that job and some of the amazing benefits I think Ray flagged for the beginning and you can take a look at, but extra job protection that comes with being a governmental employee in one of these permanent positions. So once somebody has passed the probationary period, these are permanent positions and you have the support of that permanency no matter what's happening with the funding behind your position. So while there may be a mix of grant funded and permanently or locally funded positions posted here, all of them are permanent and come with job protections that you won't find in private or even other nonprofit sectors.
Any feedbacks from Wen and Charisse?
No feedback from me. I think, again, having a commitment from the organization for permanent science branch positions for me is truly unheard of and a sheer joy. That's all I can say. So it's nice to know that the organization values science, values these positions and the scientific disciplines that they will now bring to our organization.
All right, thank you for that clarification, everyone. Again, I just want to reiterate our public health mission is to reduce health risks and provide better resources for our residents. And I'm proud of these community services. And if this sounds like something that you all want to contribute, folks, please continue to scan the QR code here and plan a career in the public health department. All right, so if we have time after the Q&A session, I'll be happy to provide a little bit more information about our excellent county benefits. Okay, so thanks everyone who are still with us at this point, and folks who just joined us just now, please continue to scan the QR code on the background and check our live openings. Welcome everyone. All right, here's another interesting question. How is your department managing opportunities to integrate access to social and healthcare related services with other public nonprofit agencies in Santa Clara County? Dr. Rudman, would you please provide your
I'll jump in
insight?
on that one. I think that's a wonderful question. And I'll start by saying that's a part of why I've landed here where I have. So in my career trajectory, I started out in clinical medicine, sort of trying to help the world one patient at a time, one sick person at a time. And then realized I wanted to do something that helped people before they got sick or set up systems that would keep them from getting sick. And I next moved to a state public health department where I found a bit too removed from what was happening on the ground with who needed help and whether the solutions could actually be carried out day to day. And so that's part of why local public health feels like the sweet spot to me, that working in a county where we have the support we have here from our county executives, from our leadership, from our employee services agency to understand what we're trying to accomplish and trying to support us in doing that means that we get to do things like work very closely with local nonprofits to understand the communities they represent, the work they're trying to achieve, the policy and funding and resource barriers they're running into, and how we as local government can support them. Whether that's with data from the science branch and supporting them with evidence, whether that's with education from our health education specialists, whether that's with resources and funding and contracts, or whether that's with on-the-ground services like our nurses and outreach specialists provide. So I would say, work with community, nonprofit, and similar organizations at almost every level. The type of collaboration is of almost every type, and the type of organizations we engage with is really of almost any type as well.
And thank you, Dr. Rudman. And I also like to share that we don't do this work alone. Public health nurses, we often work alongside other agency partners, and we refer to community organizations all the time. And so, like, for example, First Five organization, the school districts, if there is a developmental issue with a child, or, our San Andreas Regional Center, we are always looking at resources and how we can help families thrive. And so we don't do this alone. We work in collaboration and in partnership in the community we serve.
If I can also reiterate, that's one more reason why in achieving health equity, representation of the communities we're trying to serve in our workforce is so important. That understanding who we need to be collaborating with, what voices in the community we need to help elevate can really only happen if communities of color, if sexual and gender minorities, if immigrant communities, if the people being impacted disproportionately by disease are not represented in the department, we are not going to see those opportunities to collaborate with the communities who need us.
Thank you, everyone, for your specific insight and details about public health programs and services that we provide to our communities. As we're running towards the end of our section, let me just cover a little bit about the HR timeline process so that everyone can learn a little bit more about our application process. So basically, the HR process for the County of Santa Clara can vary depending on the position and the number of applicants. However, there are some general steps in the process that typically take place. So for a job posting is posted on the county's website and mirrored on other job boards such as LinkedIn or Indeed for typically 2 to 3 weeks. Then comes the application review process. The HR team review applications and resumes to identify qualified candidates, which takes about 2 to 3 weeks. If a recruitment requires an examination, whether it's a written or online exam, the process will take another 2 to 4 weeks to complete. Once you pass and your application ranked in the top 10 candidates, you will be invited to a job interview, which normally moves very quickly at this stage. Then if you got a job offer, the onboarding process will happen in 3 weeks, pending background and health screening approval. The timeline for each of these steps can vary depending on the position and number of applicants. Generally, the process can take several weeks to a few months from the time this job is posted to the time the selected candidate starts their job. Another interesting question that normally comes up during the HR review process is that how to avoid getting rejected. So in your application, it's very important to list all of the job history, education backgrounds, special projects, license, certifications, as HR will use the provided information to determine someone's qualifications. Also, we normally have supplemental questions on all of our job postings to determine someone's qualification. And we use these informations to differentiate applications from each other. A response of C resume or C above job experience will be considered as incomplete application, and you will be asked to provide additional information. If you have any other questions, please feel free to visit our website. Simply scan the QR code, and you will also find our social media channels, LinkedIn, Facebook, and Instagram, so you can learn a little bit more about county HR tips and application process. You can also contact us after the event to learn more about HR tips and tricks. So we still have 5 more minutes. Let's see if we have any other interesting question.
I can take one of the questions from the
Sure.
chat. Somebody asked about opportunities for qualitative research. Yes, there are definitely opportunities for qualitative research. Our research and evaluation team consists of not only quantitative methodology, or that is folks highly trained in quantitative methods, but also qualitative methods. As a science branch, I value very much the qualitative methods and what those methods actually bring in terms of understanding context of health, health disparities, and all the different issues that we tackle in the communities. So that ends up being a critical scientific methodology for us to really understand things that go much deeper than quantitative methods would allow us to. So there is an emphasis on not only quantitative, but qualitative as well in the branch. So there are opportunities. Take a look, look out for research and evaluation specialist positions, senior RES positions, because we do post particularly positions focused specifically looking for folks who are trained in qualitative methods for sure. So thank you for the question.
Okay, we have about 3 minutes left. Let me talk very briefly about the great benefits that the county offers to our employee. Not only the employee, but also their family. The county runs its own health insurance plan, which doesn't require any contribution from employees and provide access to Valley Medical Center, Palo Alto Medical Foundation, and Stanford Hospital. Plus, we offer generous vacation and sick hours, as well as 13 paid holidays. And what's really impressive is that the county's benefits don't stop after an employee separates or retires. In fact, they offer CalPERS, also known as pension, which guarantees a regular stream of income even after an employee is no longer working. The size of the pension depends on the number of service years. So the longer you stay with the county, the larger your pension will be. And here's the cherry on top. Once an employee retires from the county with 15 years of service, and at age 50 and or older, they will receive free healthcare coverage for life. I hope this little benefits presentation provides you a quick overview of the fantastic benefits package offered by the county. If you're interested in learning more, please don't hesitate to scan the QR code or send me a message on LinkedIn. All right, any other concluding words from our speakers today?
I just want to thank you all for the opportunity to share what's happening with us here in the Public Health Department. Again, I think there's been a light shown on what we do in public health, how it differs from healthcare delivery or from health policy, and really bridges between those two worlds and everything in between. And I think you've heard some examples here today about what that can look like for Santa Clara. But what I'll add for folks who are thinking of a transition from elsewhere, part of the reason I can't imagine not only doing any other work but this, but doing it anywhere else, is the way that we're willing to be out front here in Santa Clara. We take risks to fight for the type of work, the type of people we're trying to make healthier, and the novel ways to do this work in a way that I've seen us lead across the state for the entire pandemic and already be headed out in front even as we head into recovery from the pandemic. So I welcome anyone who's worked elsewhere in public health to consider coming here.
All right, thank you all for sharing your professional insights and suggestions for today's section. This has been a very informative and providing valuable reflections on the functioning and delivery of multiple public health units, including our team structures and career opportunities. Your passion for the job is truly inspiring and demonstrate why our department is an excellent place to start or continue a career at public health. I would like to extend a huge thank to Sarah, Dr. Sarah Rudman, Charisse, and Wayne for joining us today. Please feel free to check out career opportunities on the QR code or connect with me on LinkedIn to discuss any vacancies or opportunities in the department. It has been an honor for me to host this section, and we hope to see you again in the next chapter. Thank you, everyone.
Thank you. Thank you.
Thank you.